Welcome to Weekends with Amit with yet another new episode, and I am your host Krishanu. These days, or I should correct myself, not these days, generally, firemen are in demand. Why? Because firemen are called when there is a fire ablaze already, and this is how we handle our own health. We hold off doing things that are right not before or before any symptoms happen. When the symptoms come, when the fire is already on the house, then we become conscious and call the doctors and other assistants and other people to help us. What if we could do something that would not require us to call these people? What if we could become our own doctors? Now, today's subject is basic preventive medicine. And to discuss on this, we have Professor Amit Goswami and Dr. Valentina Onisor.
Thank you, Krishanu.
Uh, for both of you, particularly with Dr. Onisor, it would be a very common subject in the sense that a lot of people would have come to you to understand how we can do this, how we can run away, or how we can prevent the firefight in the first place. And with Professor Goswami, we'd like to know the quantum aspect of it. Whereas we often know that the body that we look at, the body that is made of, um, say, blood and flesh and all, that's not the only body we have. And we would like to have the quantum perspective, quantum angle on the preventive medication part. So we'll start with Professor Goswami as usual, and then we'll move on to Dr. Valentina. So, Professor Goswami, the floor is all yours.
Hello, everyone. Well, preventive medicine is very, very important today because we finally have developed what is required for preventive medicine. Has not been there, but because the time was not quite ready, the science was not quite ready. Um, in fact, the way we use healing science today is dominated by allopathy, and the allopaths assume scientific materialism. Matter makes everything. All our ailments, all our happiness, consciousness included, everything is the movement of matter. In this very dogmatic and myopic view, there really isn't possible to make a complete theory of medicine simply because our health is not purely of the physical body. We have, besides the physical body, other bodies, but this is missed completely if we hold on to the dogma there is only physical. When we allow non physical, and quantum science insists that there is non physical in our constitution, and notice the word insist, it is compulsory. Quantum science theory insists that there is a domain outside of space and time, a domain in which matter included, everything is potentiality, and mind, vital energies, supramental archetypes, they all can be introduced as potentialities of consciousness to choose from. When consciousness chooses, we get experiences in each of these worlds: physical, vital, mental, supramental. We even get an experience of our consciousness itself, which gives us joy and bliss. In this way, we get the various bodies, 5 bodies: physical body, vital body, mental body, supramental body, and the bliss body of consciousness itself, represented in manifestation. And therefore, health is the health of all these bodies, and we have to know their theories. Allopathy is based on Newtonian physics, and therefore misses even the basic theory of material part of the body. It cannot really deal with it, let alone the vital, etc. And the problem is that often the disease is not at at the material level, the disease is at the subtler level, vital, even mental, even spiritual level. And then you have to really get to the source of the disease. That's the basis of the preventive medicine. But again, remember that allopathy is a very young science, although the ideas, original ideas, have existed, but they really were quackery. Well, not really any substance in the medicine that was practiced. In this style of allopathy based on materialism, not completely though, but whatever they had in material terms or any terms, most of it is nonsense. So material science made an improvement by introducing germ theory, introducing hygiene, introducing and discovering antibiotic medicines, and of course, tremendous improvement of surgery and knowledge of anatomy and physiology. Those things have to be added. Credit has to be due. But this is all experiment based. This is called evidence based medicine. Except for germ theory, it has no theories. And now we have a complete theory. We have complete theory of all the five bodies. And therefore, we can talk about preventive medicine because we have the theory. And when Kishanu introduced the subject, he was slightly too optimistic. If you want to use preventive medicine, you will need to learn the theory. And it is better for you to not bear the responsibility completely. So we completely suggest, fully suggest, that you work it out with the help of a medicine practitioner. But the main thing about preventive medicine is responsibility got to be yours. It's your health, for God's sake. In materialist science, we don't recognize it because we are just machine. We cannot talk about our health except like a motor car's health. And when the motor car goes awry, then only we go to the service station. But our human body is not like that. We are not machines. We could be sensitive to what is going on, even before it goes awry, because it is a fact, as homeopathy has taught us for a long time, as Ayurveda has taught us for a long time. It is a fact that subtle symptoms appear long before the physical symptoms that today's doctors recognize one and only. They are the only symptoms for them. Psychologists recognize some of the psychological symptoms, but psychology is practiced by mental health practitioners, and the two never talks much. So in this way, the physical aspects of medicine, which is the last stage of the disease, that gets all the attention, and that is where the people who have it, they become most aware because it is physically painful and it is physically recognizable not only by others but you, and therefore you take care of it. And the psychology of today's whole culture is such that we postpone everything that requires our responsibility, our sensitivity, our doing something about our health. It is so interesting. We want everything, but we don't want to take responsibility for it. We don't want to do anything about it. We want it like swallowing a pill. And of course, the big pharma caters to that and makes billions of dollars of you, and often at your cost, because the price you pay is serious. Old age has deteriorated so much. We live longer today, but we don't have any quality of life beyond the age of 50. At previous ages, people didn't live very much beyond 60 or 70. But as Valentina says, they probably had in their entire life just one disease from which they would die. But today, Today, getting old is no fun. Getting old is no fun, no quality of life. Symptom after symptom, disease after disease, the cure, medicine itself produced more side effect, eventually more disease, and you die a death of total indignity, and often you don't even have a memory for it. Alzheimer, dementia. So if you want not to live like that, you've got to take responsibility. You've got to learn some of the aspects of what health means. And these principles are quite simple. If you know those principles, and if you know that we have five bodies to take care of, and if you know the basic nutrition, which consists not only of food, not only of vital energies, massages, vital practices, meditation, but also some knowledge of what is involved. And you will see that a dynamism consisting of both conditioning and creativity is involved. Most important thing you will see, I will let Valentina elaborate on all these things. Most important things that you will see is that we have built-in negativity in the brain because of no fault of ours, just that an animal ancestry, evolution has given those to us. But the correctional mechanism is there in our consciousness as potentialities. So we can change the brain. We can also change the physiology of the body. And if you are aware of it, you will find that it's a dynamic balance, and that's what you have to learn to maintain. It is best to take guidance because the theory is not entirely simple. The practices that you need to do require some training. And of course, somebody who has traveled the path, and this requires the training of a new bunch of physicians who actually work that talk. They themselves must use preventive medicine. They must themselves be devoted to achieving wholeness. That's an archetype represented in our health. If we are healthy, that means we are good representations of the archetype of wholeness. If our health goes awry, that means we are full of conflicts. We are no longer whole. So how to re-achieve the wholeness is the job of the physician. But the physician must be aware and be able to do it himself. And this requires training. You hear today's doctors often talk about empathy, but they don't even understand it because empathy understanding requires quantum physics, requires the quantum concept of non-locality, signal-less communication, requires even more intimate relationship that we call tangled hierarchy. And these things, the healers has to practice. That's how you become a quantum healer, quantum doctor. Today's doctors are a sad imitation of what a healer has to do, what a healer has to learn, what a healer must practice. So it is a job that is a job for committed healers, committed to transformation, committed to learn about wholeness, and be there for the guiding light to people who neglect their health, who has to be awakened to the knowledge of health science, quantum health science, and together they can manage your health successfully. For more details, let's go to Valentina.
Hi, everybody. Yeah, Amit, hearing you talking, it just raised some kind of revelations inside of me. Very interesting because I realize again more clearly now that being in a state of health and understanding what is health and really being again able to perceive it, because again, after some time, after some 40 years of age, you even forget what it means to be really healthy. It's a state of being very rich, actually, and then if you go back to how we describe the archetypes, and we start with explaining why the archetype of abundance has to be approached until we reach a certain level in abundance. That means approaching abundance for all the levels of our being. We cannot really go seriously to fulfill the other archetypes. So now I got very interestingly how abundance and then even power is definitely on the path of awakening yourself as a doctor, but it's much more than is happening, because even for me, I mean, in my country, but I'm sure in other countries as well, people go to a doctor or a priest, they are kept very high, and yeah, with all their secrets, all their problems. And yes, if I mean, it is a kind of empowerment that comes, people coming to you with a certain openness if they really want to heal. So many people just go to a doctor or a priest in that way without a real intention of healing. They just want, oh, take this pain away. But behind any kind of pain or something that is torturing us in any way or a sufferance, there's a deep, deep message of transformation. And even in this period, you see around you how many people, even due to anxiety, they are just ending up very quickly in a miserable state. Not just their brain is affected, but eventually all kind of diseases which were in a potential state already existing in their being, they are coming up, springing up. It's kind of, even the lies in the society, they are coming up. So what I see in this period is that many stagnant diseases that were not looked upon seriously, they are coming up now for many, many people. I know personally many of such people. And then the question is now, do you really want to heal or not? Sometimes such a question really comes with this message, yes or not. And if not, okay, exit, next chance, another incarnation. But and also it's the same with what's happening now in this crisis situation. Crisis is an opportunity, and the same also a disease or a sufferance is a great, great opportunity of transformation. So transformation and healing, and obviously this archetype of wholeness, go hand in hand. Yeah. And it's a lot to talk about this preventive medicine. It's a beautiful subject, and I heard first about it a lot from my father. He was specialized in many of the area in preventive medicine. And then later on, I discovered myself. And then when quantum science came in my life, then it was much more and things came in place. And we are in the process of publishing now a book on this subject. So it's by the end of the year will be published with Amit. And so to put it in an idea, preventive medicine is around this idea that it's much better to prevent than to heal. Just meditate on that. So it's much easier to prevent something than to heal it, when it's late. And not too late. So it's never too late, by the way. Until the last moment is really never too late. And nowadays we kind of lost, especially due to all this information processing and depending on technology and all this AI, what's coming, we lost touch with the existence of very strong prophylactic methods. Prophylaxis, it's another name for prevention, kind of, So there are, of course, many of such methods which are very strong, which can dynamize and strengthen, for example, the immune system, and allow us to fight easily with the contamination, and also offering chances to avoid all kind of contaminations, And that's why we describe about naturopathy and around the herbs. It's a lot to talk about this. Read also the article on COVID that you will find on Amit's website. I suggest really to read that because it's very interesting and gives many, many tips that can be applied not just in this situation, but in others also. So prophylaxis, again, it's exists it's again, preventive medicine cannot really exist without a precise knowledge of the causes that, so it's about finding what is that cause. And of course, when you find out about this, the bodies, and of course also the practices to bring that state of harmony and synchrony, and then you find out, for example, how is it possible that, of course, something, a negative thought that you're maintaining, for example, a state of hate or revenge, that you maintain it over and over and over, and you're feeding yourself with that, which is much more than the food that you're eating. You're feeding yourself with that negative thought, so that eventually, if you don't quit maintaining that thought, thinking that that person doesn't deserve to be forgiven, for example, that will affect you very greatly, so it's a gesture of love and compassion, obviously, towards yourself, first of all, to want to get out of this kind of vicious circle that is very, very destructive. And also think about this, that there are not really diseases on the term of diseases, even if in medicine, in allopathy, you find all this name of diseases and just one name for health. Just think about it. So there exists, of course, people who are in a kind of sufferance or sickness, in a special affection, but the way a human being is experiencing a certain disease or sufferance, of course, is very different. It's individually. So the more the doctor has worked with himself or herself, the more you will be able to approach a person one-to-one. And again, the same disease or sufferance can be lived very differently, by each human being. So the nature of a human being has a proper terrain, if you want, and this makes each human to be affected by something in a specific manner, according to your resonances that you have there, according, of course, to your typologies, if you know, in Ayurveda, and your preponderances, your patterns that are there. Of course, it's also related to the respective karma, which is again, great lessons waiting there that we have to learn in this life. And even if, for example, it's something very, very difficult, when a person is confronted with such a very difficult karma, let's say, something which is acute and is mobilizing very strongly, and maintains a state of optimism and enthusiasm and perseverance, of course, so that's very, very interesting to see how these people come out of such moment that for other people would be so difficult or impossible, and they come out of such moments really transformed. And the idea is to also not just be in this passive and inert state of waiting, so even if something manifests around you, like it's a disease around you, or even inside, in your being, something starts to manifest. And it's not about just sitting and waiting, but learning about such preventive methods that can really dynamize your being and strengthen, And so it's not about being in a state of isolation and victimization, first of all. Then, of course, for example, you have a viral infection in this case, but actually nowadays, of course, most of you, that it's also a mental infection. I'm not going to describe all this panic effect that was created and the fear and anxiety and what's happening with that. So, and all the obvious and not so obvious aspect. But the idea is that, for example, how you treat a viral infection in conventional medicine, it's a big question, because antiviral medicines don't kill the virus, they only keep it captive in the cell, stopping it to reproduce, and then medicinal herbs, for example, they are much more superior because they have a large spectrum of defense to face even immediately viral infections. There are really antiviral plants, and I'll give you a few examples, and which can directly interact with the viruses, and they kind of conquer the infected area, inhibiting the synthesis of the protein and of the virus genome. And there is research proving that plants have a complex answer against viral infections, that activates and even teaches, very interesting that, so they are teaching our bodies according to what they are interacting with, and this program of this herb is setting up in action is set up in action when the plant or the herb that is used in the form of a valid powder, which has virya in Sanskrit, which means power. So this antiviral mechanism of a plant is very complex, and even if it's not entirely understood yet, but it's much superior already to any allopathic medicine, you know. And of course, the big pharma is not interested to promote natural herbs remedy because they don't bring profit, of course, right? Yeah. So just to give you again these examples, if you want to study the case, it was in the bubonic plague study about that, you know, and it's called phytoprophylaxis, you know, and it was called the elixir of the four thieves, or the four thieves vinegar, or Marseille vinegar, and the components of this elixir that was used were clove, lemon, eucalyptus, rosemary, and cinnamon. Yeah. So study around these things if you're interested. But I'm sure many of you know already about these things, because I know many people who already know very well and practice seriously medicine with the serious intent towards wholeness, you know. So yeah, that's just an introduction.
That this was a wonderful introduction, and I believe Professor Goswami will agree. So, if Dr. Valentina Onisor wants to continue, that's wonderful. So, please continue.
All right. So again, you'll find a lot of elements in the book. Yeah. And there are, again, of course, over 2,000 viruses detected. I don't want me to keep a course on virology right now. And only 10% of them are infecting humans. Yeah. And how the human body fights a virus. So the first defending line, of course, is the skin, the mucosis, the gastric acid, and you inhale. Yeah. And then the mucosis is capturing the virus and tries to expel it. Or if you swallow it, the gastric acid will kill it. Yeah, and if the virus is passing this first line of defense, then the immune system is activated. If the immune system is there, right? If it's active and strong, and the leukocytes, you know, then the interferon to protect the surrounding cells and so on. And if they cannot destroy the virus, then the lymphocytes will come to help. The T cells and B cells, you know, they keep in memory the previous infections that are suffered, you know, and then they are formed with antibodies, and the body will know how to combat, how to fight what the body already knows, you know. But the viruses, as you know, they suffer mutations, yeah, and then when the body doesn't recognize them, that's another story again, you know. So also, of course, sometimes viruses can act so fast that they manage to kill even before these lymphocytes react. So having an immune system which is wonderfully active and awakened, it's a big one these days. And of course, you know, there are so many autoimmune diseases existing now, and the mechanisms already, some of them are deciphered. And it has to do also with the way we deal with ourselves, and we are counteracting ourselves, you know. So instead of being on our side, many times we have all these mechanisms of too much self-defense, of even again counteracting whatever we are and we do. So again, in that book, you'll find tons of clues, and of course, we have our courses where we invite you to study these things much more in detail. And again, the idea is to be active and know about all this richness that we each have, you know, and manifest it.
Great. So, Professor Goswami, up to you, and thank you so much, Dr. Ronnie, sir. But we have a little shortage of time, so I request you to be brief and give a good summary of what happened today.
Thank you, Krishna. Okay, I will be very brief. Being healthy is a mindset. Intend fully that you want health, and remove all those conditions as much as possible that brings you not wanting health. And believe me, there are plenty of those things. that makes us not to want to live. You must have an enthusiasm for living. And the key to that is bringing meaning and purpose in your life. Key to that is learn to live in expanded consciousness in spite of the fact that the brain, in a natural way that it evolved, makes us overwhelmingly negative. The immune system, the natural way that we are born with it, if we leave it at that, is very defensive, and often inappropriate defensive. And so these two things, if you remember, that much of our negativity arouses the immune system, and the immune system becomes hyperactive and inappropriately acts. And much of our ailment is because of that. So how to prevent the immune system to act like that? You have to learn to love. You have to bring love in your life. That will bring you the positive side, the expansion of consciousness that we talk about. It will also bring the immune system to a much more healthy balance in which it will know when to act, and appropriately. Why does love help the immune system to function better? Because immune system is the second most important system. Just like our brain, immune system needs rest. We give the brain the rest because if we don't, we immediately feel disjointed. Unfortunately, the immune system disjoint cannot be felt so readily, so we tend to ignore it. But actuality is that we suffer very much also from the immune system disorder that happens when you don't give it rest. How to give it rest? Very easy to understand. When is love? Love is when the immune system, this reaction to others that I have to defend against you, gives way to an acceptance. I suspend voluntarily my immune system, momentarily. And in that momentary rest, the heart becomes alive and becomes quantum, and the feeling associated is what we call love. As simple as that. So, love is a way to give rest to the immune system, to have a healthy immune system, to find love in your life for both positive expansion of consciousness and prevent the defensiveness of the immune system that makes the immune system unhealthy and all kinds of disease that you get. Simple recipe. A little more advanced recipe is also learn about self-love that will make the navel chakra healthy, and that too is hugely helpful towards maintaining health, keep us away from the chronic disease. Most of all, do not hesitate to consult a quantum doctor who will teach you how to manage your health quite inexpensively without all these harmful pharmaceutical drugs, with simple herbs occasionally and exercises, food supplements, and a healthy attitude towards life. Thank you.
Thank you so much. Thank you so much, both of you. This simple remedy could be so powerful. Actually, most of the things which are very important to us comes free. So love is one such thing. And the way it is described today in today's show, how the preventive medicine, the theory of it, and a lot can be done, as Dr. Onisar also explained about herbs. This is going to be the way forward for the most inexpensive, but yet the most potent preventive treatment. You can have more information about us on www.amitgoswami.org. And if you have any questions or comments, please write to us on info@amitgoswami.org. we'll be very happy to reply to you. Thank you so much and have a great weekend.